Thank you so much for being here, Cassie. You're the co-founder of the California Perinatal Wellness Alliance. So talk to us about your mission to support parents.
Yeah, so we are a survivor and community-led alliance working to transform California's fragmented perinatal mental health system into one that is just, inclusive, and sustainable, where every birthing person and family has access to care, dignity, and support. And we do that through a focus on policy and systems change, storytelling and narrative shift, and movement building.
So here in California, we know 1 in 5 mothers and 1 in 10 fathers will actually experience symptoms of depression and anxiety. So what message do you have for new parents who might be experiencing these symptoms?
You know, the most important thing is to know that these are preventable, treatable public health crisis issues. Too many families are suffering in silence and falling through the cracks, thinking that, you know, these are issues that are normal parts of motherhood or something to hide. But when we tell stories and destigmatize, we realize that, you know, they do affect 1 in 3 moms, and support is out there, and that we can all be a part of treating this not as an individual issue, but as something that all families, communities, and policymakers need to care about.
Yeah, this is something that can impact everyone. So California Perinatal Wellness Alliance recently facilitated a conversation with state officials and advocates trying to address the perinatal mental health crisis. So what were some key takeaways from that conversation that you had?
Yeah, so we were so proud to bring together 40 leaders across state agencies, health systems, and community members. And there was real alignment that we have as a state made a lot of progress. And screening has improved, but the biggest gap is around implementation being fragmented, and really making sure that screening translates into diagnoses, treatments, and follow-up. So what we heard clearly is that California has all the pieces, but they're not working together yet. There is real momentum across state agencies, health systems, and community leaders, but it's really that gap around what happens after someone screens positive, around the follow-up care and navigation and accountability. You know, families experience the system as one journey, but we've really built it in pieces. So we're trying to align systems and make sure that families don't fall through the cracks unnecessarily.
So what action can the state take this year to address the perinatal mental health crisis?
Yeah, so there's a lot that the state can do. Some of the things that we're looking at are care coordination, you know, making sure that if someone is diagnosed, that they're not just given a paper of a list of therapists to call, but there's really case management and care coordination, just like for other high-risk pregnancy issues like gestational diabetes. There's health plan support built in to help folks navigate, especially if you're depressed and in a dark hole and caring for not only yourself but a baby. Having those resources and support for folks who screen positive to access the treatment and referrals and follow-up care. And there's a lot that the state is already doing, especially with the Department of Healthcare Services birthing care pathways that centers equity and follow-up care. But what we're really looking to do is help the state strengthen accountability by integrating maternal mental health into existing health plan quality improvement and oversight processes, and really making sure that patients, mothers are at the center of these systems.
Yeah, and this is really what it's all about, right? So in September of 2024, California actually launched the Strong Start and Beyond initiative, and we know that the goal is to reduce maternal mortality by 50% by December of this year. So from the work that you've been doing advocating for mothers and new parents, do you believe that the state can actually reach this goal?
That's a great question. There's so much to be done, not only from the part of the state, but from community organizations, parents, clinicians. You know, there's big challenges in workforce development, for example. So the fact that perinatal mental health is the leading cause of maternal mortality, yet perinatal mental health is not a required subject for therapists' licensure. So it's one of those preventable public health crises that's hiding in plain sight, and a lot of folks aren't even aware. So it's sort of a you don't know what you don't know issue and a systems issue. And so a lot of advocates have been concerned about that goal not really quite having enough metrics behind it, and that's why we're taking a real big tent, coalition approach and trying to align both the public awareness through storytelling and narrative shift, the policy and systems change to make sure the steps are there to connect the dots across screening to treatment, and then really cross-sector alignment and movement building, because just like we've seen in movements like breast cancer, where we have seen real improvements in screening that led to a lot of successes in cancer reductions, and it is an issue everyone knows about. You get your mammogram every year, and it's so easy, right? We can do that with perinatal mental health, but we all need to be a part of the solution.
Yeah, and it's just really having that conversation and making sure that people are aware of the issue, right?
Exactly. That's
all right. Cassie, thank you so much for your insight. We really appreciate it.
Thank you so much for the opportunity. Appreciate y'all.